Should this be on?
Oh, sorry.
It's okay.
Didn't get her yet.
That's
I
it.
didn't see the power button.
That's
okay.
all. You can't read it. That's why we've gone to the Samsungs, because those ones are a little hard to operate. All right. So, I think I'm going to lock them in now.
Am I ready? Yeah.
That's true, will be vanished forever.
Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, September 16th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, good afternoon and thank you. We've all seen the numbers of new cases of COVID-19 increasing in our community, particularly among younger people. We've asked for more information about these cases from public health and particularly where they're happening. And while the analysis is still being carried out so as to ensure an accurate accounting, the evidence points to social gatherings, people getting together with friends and extended family, particularly those that take place indoors. People are breaking their social circle of 10 people and they're becoming infected with COVID-19, often from these gatherings. This puts the work that we've done, all the work that you've done, fighting the spread of this virus over the last 6 months, it puts that work at risk. So that's the behaviour that we need to change. I know that the vast majority of Toronto residents are doing the right thing, and the vast majority of Toronto residents don't want things to get to a point where we would have to go back into a further lockdown. That would not be good for anyone. This morning, senior members of the City of Toronto team met with the Medical Officer of Health to discuss what public health measures would be effective in helping push back against this resurgence. Dr. Davila's advice, based on the knowledge of current COVID-19 cases presently in the hands of Toronto Public Health, her advice was clear. Reduce the social gathering limits, enhance enforcement on existing restrictions, and expand the mandatory mask requirements. Over the coming days, we will be moving to act on all three of these areas, some of which will require cooperation with our partners in the provincial government. I spoke with Premier Ford earlier this afternoon to indicate my strong support, Toronto's strong support, but mine as Mayor of Toronto, for action the province may undertake to reduce social gathering limits. And we will support their actions in this area, as well as any actions they may undertake to provide for consequences which follow enforcement activities. I've also been speaking with the Government of Canada about the need to redouble their efforts when it comes to quarantine education and enforcement for travellers. The masking issue is a more complicated one, legally and jurisdictionally, but I reiterate my own often stated view that the more we can have more people wear masks more of the time in more places, the better off we will be as one tool in the fight against this virus. We are taking these actions now so that hopefully we won't need to take more drastic actions in the near future, like another lockdown. That was a sledgehammer. It was a needed sledgehammer at the time in our fight against COVID-19, when case numbers were even worse than they are today and the trend lines were even worse. Now we actually have the ability and the knowledge to respond with more tactical kinds of responses that target the exact behaviours that we know are helping to spread COVID-19. I know that people have COVID fatigue. People are doing the right thing and following the public health advice, which is to wash their hands and to wear a mask and to keep their distance. Those people who are doing the right thing are tired of this routine, and they're frustrated at those who aren't doing the right thing. People, particularly young people, They want to have fun. They want to live their lives. I get that. But the fight is not over. COVID-19 is still here. We know how to fight it, and we will do so in full cooperation with the other governments. We know that we can fight it successfully. That's why we're able to open schools again, able to open restaurants again, able to have seniors receive visits in long-term care homes again, and we're able to bring back some degree of normalcy to our city and to our society. But that doesn't mean we can let our guard down. The choice isn't to do or not to do these things, to open all of these places or to close them all. We can have a situation where we remain more open than was the case in the spring, but with ironclad respect for basic public health guidance. We must double down on hand washing, on social and physical distancing, and on wearing a mask as often as we possibly can. If we do this, we will win. We've often said from the beginning, because it's true, that we were all in this together. And let's keep proving that that's true. And on that note, I will ask Dr. Davila if she will offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I'm reporting 86 new COVID-19 infections. This brings our total COVID-19 case count to 17,028. A total of 15,089 people have recovered from the virus. There are currently 20 people hospitalized due to COVID-19 infections, and 7 people are in ICU. As of 10:30 this morning, there were 6 cases amongst staff at local schools. 2 things are happening in Toronto. We are getting used to living life under reopening, and we know we are entering resurgence because of the increase in the COVID-19 case numbers. Our reproductive number is 1.2. That means that each new case of COVID-19 infection is creating 1.2 further cases. That's why we want to see that reproductive number below 1. And this is done in large part by the steps for self-protection we always reinforce: watching your distance, wearing your mask, and washing your hands. Reopening let us do many of the things that were shut down last spring. Resurgence means we cannot act like we're back to normal. We're not. We want one, but not the other. And the way to do this is to use the steps for self-protection that will reduce virus spread. If you do these things, we can affect the direction of COVID-19 infections. If the direction doesn't change, there is a real chance new restrictions will have to be imposed. We know this because we've seen this in other countries from around the world. We're now 6 weeks into reopening in Toronto, and a picture is emerging of infections in our city. In these last 6 weeks, approximately 50% of COVID-19 infections are categorized as close contact, meaning as a result of exposure to someone whose infection is known, although it may not have been evident when they infected someone else. Close contact can happen anywhere, with family, at social events, at work, especially anywhere that masks aren't being worn and physical distancing isn't happening. About 20% of cases are from community transmission, meaning that we aren't able to be certain about the exact source of their infection. In the big picture, here are the places where transmission is happening. Socializing indoors. Big events with crowds where people forget about taking steps to protect themselves. And as well, bars and restaurants, especially amongst their staff. Our data tells us people are getting COVID-19 in part by socializing indoors without wearing masks while standing too close together and for too long. It's happening particularly at events where your guard is down. My team is currently investigating and tracking 4 separate weddings that have so far generated 22 infections. Remember, prior to their positive test, these 22 people would have been contagious, possibly without knowing it for a period of time. We're also seeing patterns emerge that point to infections from smaller gatherings. Everyday events like play dates and gatherings of extended family. As I said Monday, you cannot tell if somebody has COVID-19 just by looking at them. And just because they're family or friends or people you know well from work doesn't mean they can't infect you. We're seeing an increase in cases at businesses like bars and restaurants. And interestingly, where workplaces are involved, we are seeing infections more often between staff and less so between staff and customers. One venue generated 6 confirmed cases, 4 in staff, 2 in patrons. Another generated 9 cases, 7 staff, 2 patrons. At a restaurant with 5 confirmed cases, they were comprised 4 staff and 1 customer. Our investigators have also noted that people are coming to work with symptoms and working during the time when they're infectious. I cannot stress enough that if you know you're sick or you think you might be, the first thing to do is to deal with your symptoms and keep apart from others as much as possible. I know for many people that this is easier said than done. You need to work to make a living. I encourage employers to support staff who are sick by making it clear you want them at work only when they're well. And I encourage employers as well to manage your business to allow for sick time if you can. I recognize that this is a big ask of you in uncertain economic times. But the sooner we grapple with COVID-19 in the world around us, the sooner we have the world around us that we want. Please, don't start thinking that this place is safe and that place isn't. You can be infected anywhere if you're not taking the right steps to protect yourself and to protect others. The key thing is what you do. Watch your distance, wear your mask, wash your hands, and also weigh where you're going and whether you need to. If we all think about risk as we go about our daily lives, and we act to address risks by taking the steps for self-protection, it will make change and prevent a lot of stress, cost, and heartache. We've done this before. We did it last spring. We said stay home, and everyone did, except all the brave people who had to go to work every day to supply the necessities of life in the city. We gave you advice and direction. You took it, and it worked. The curve flattened. The case counts went low. So please, take on board what I'm saying now. As much as possible, limit your contact with people who don't live with you. Ask yourself, is where I'm going somewhere I need to go or somewhere I want to go? And if I only want to, can it wait? Is there a low-contact way to do it? Ask yourself, am I going to be in a group that I know is too big to be safe? And no matter where you go, or what you do. Watch your distance, wear your mask, and wash your hands when you're home again. We're in a transition period as we approach the fall and winter months. We're at a crossroads, too. No one person will decide what happens next. It's what we do together and what happens as a result. With that, I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 190th day of continuous Emergency Operations Center operations. Our EOC continues to operate, ensuring that both critical and essential services are being provided without interruption. I'm proud of every member of our team who continues to work hard each day in support of our residents. From the outset of COVID-19, our overarching incident management system priorities have remained unchanged: to save lives and prevent the spread of COVID-19 in our city, and to prevent our healthcare system from becoming overwhelmed. These priorities continue to guide all that we do in planning for and responding to COVID-19. This afternoon, I will provide our weekly personal protective equipment update. At present, our PPE levels remain stable, and our team continues to work hard to source the equipment that we need on a go-forward basis. Based on current consumption rates, our PPE inventory levels are as follows: a 59-day supply of N95 respirators, a 500-day supply of surgical masks, a 289-day supply of isolation gowns, a 765-day supply of face shields, and between a 75 and 713-day supply of disposable gloves, depending on the specific model. As you can appreciate, we require a number of styles and sizes of gloves to meet the variety of needs on our front lines. In addition to our operating inventory of PPE, which I just outlined, we also maintain a pandemic PPE reserve for use in the event that we are unable to maintain operating inventories. At present, our pandemic reserve includes an inventory of both N95 respirators and surgical masks. As you know, managing PPE has been a constant challenge throughout the COVID-19 pandemic. As a city, we remain committed to achieving and maintaining a PPE inventory of no less than a 6-month supply, based on the maximum PPE consumption rate across our city. We built and continue to operate a robust PPE management system, and our PPE inventories are being actively managed and monitored on a daily basis. Many of our frontline services have developed and implemented PPE conservation measures that are greatly assisting in our ability to maintain the supplies that we need. Further, a number of our frontline services, including emergency services, are continuing to pursue alternate PPE solutions in order to continue to reduce our reliance on high-demand PPE, including disposable N95 respirators. We have developed comprehensive processes like these, ensuring that Toronto remains well-positioned to respond as the COVID-19 pandemic continues to evolve. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, there are a number of staff on the line who can answer specific questions media may have, including staff from Municipal Licensing and Services, Transportation, Shelter Support and Housing, Senior Services and Long-Term Care, and Parks, Forestry and Recreation. The first question is to Kelly Grant from the Globe and Mail. Kelly, go ahead, please.
Hi, thanks for taking my question. This is for Dr. Davila. You mentioned that there were, I believe it was 3 restaurants where there had been transmission among staff, but also to a couple of patrons. Can you name those restaurants and tell us why there haven't been public notices related to those places yet?
So, Kelly, just to be clear, I spoke about venues, one of which was a restaurant specifically. But I did generally in the remarks refer to what sources of transmission exist in the city, socializing indoors, particularly at big events being one of them, and certainly bars and restaurants, particularly amongst staff, that appear to be, popping up on the radar, as it were, in our investigations. So a couple of things with this. Given the existing regulations, in order to provide for as safe a reopening as is possible, we actually have lists of individuals. So we know who the contacts are, when the relevant exposure periods are, and so those who are at any kind of public health risk are informed accordingly. And given that we have cases, we know that one of the steps in case management is isolation. So that effectively removes the risk to the public. So we haven't seen ongoing transmission. There are going to be cases that exist, I think, throughout our city, and some of them are going to be in settings like bars and restaurants. And yes, they're going to be in places like schools. They may be in workplaces, etc. So fundamentally, what this points towards are the self-protection measures that each and every one of us has to take on a daily basis. Watching our distance, wearing our mask, washing our hands. And otherwise, we in public health will continue to do our jobs with our case management and manage risks at that level as well.
Follow-up, Kelly?
Yeah, could you tell me what types of venues the others were if they were not a restaurant?
Well, one of the things that we talked about were things like weddings and large family gatherings. These are the kinds of events where we see a lot of socializing. It often moves into an indoor setting, and it's a situation that lends itself to people letting their guard down. Workplaces also sometimes have that kind of give people that feeling that they can let their guard down. You know, you're working with people you've worked with for many years, you finish your shift, and sometimes you go into the lounge or have a conversation. People let their guard down, mask comes off, close distance is all of a sudden, or close contact is created, and now you've created a circumstance for risk. So that's why the settings aren't so much the issue. Other than the fact that we're looking at closed spaces, indoor spaces where risk is definitely higher. It's about watching distance, and when you can't manage the distance, wear that mask and wash your hands. There's a lot of self-protection capacity that each and every one of us has to reduce the risk of transmission.
Okay, thank you. We'll go next to Rahim Ladhani from CTV News. Go ahead, Rahim.
Hi, my question is for Dr. Davila. Dr. Davila, you mentioned that there were 6 cases among staff at local schools today, and we've seen dozens of cases pop up with students and staff heading back to class now, and now high school students are heading back to class tomorrow. So I'm wondering, from a public health standpoint, are there any unique challenges when it comes to asking high school students who are older to follow guidelines in place compared to young children?
Well, I don't know that it's unique particularly to high school students. I do live with a couple of high school students myself, and I think that they're aware of the risks, but I think they're just as human as the next person. There are moments where we let our guard down. That's exactly what we're seeing within the context of our case investigations. We think that some people, they're our friends, we're close to them. I can't possibly get infected from these individuals. We were together all day. How bad could it be? So I think that they suffer probably from the same sort of conditions that the rest of us do. And that's why it behooves us to continue to have this conversation with our young people and, frankly, through all members in our community, to say that, in fact, look, COVID-19 exists in our community. We are trying to find together the right balance between COVID-19 control and having access to the many services and amenities that we want to have quality of life. So for everyone, high school students included, all those in the school community, self-protection measures, watching your distance, wearing your mask, washing your hands, thinking about, am I sick? Do I need to be here? Is this an important enough activity for me to engage in? And really reflecting on what we do so that we can manage risk for ourselves and for everyone else around us.
Follow-up, Rahim?
Yeah, thanks. And I guess my follow-up would be for the mayor, just in terms of what would your message be to these older students going back to class tomorrow in terms of their responsibility? I mean, if young kids go to class and you need to remind them to put up a mask, that seems understandable. What's the responsibility of these older students when it comes to stopping the spread?
It's the same as we offer to them by way of life lessons in many other areas, which is as you get older, more is expected of you. And while it's understandable that a 5-year-old kid may not understand about a mask and why it's important or why it's important to stay away from his or her friends during this pandemic, teenagers, high school students should be expected to know more. And we're not trying to stop people from having a good time, enjoying being with their friends at school, being back at school. We're just saying that there are some rules everybody has to follow, everybody who's able to understand those rules, and certainly high school students are. And we hope we will get their cooperation because they're not immune and they're capable of attracting this virus and then spreading it to others. So we want them to be on the team and in the game with us.
Okay, thank you. We go next to Mark McAllister from City News. Go ahead, Mark.
Thank you. A question for Dr. Davila. Could you expand a little further on the 4 wedding events that you mentioned and the 22 cases? Did those events take place in Toronto? Are those 22 cases only based on individuals that live in Toronto, or are they outside the city as well?
So, Mark, actually, where the events take place is probably less the relevant thing. When it comes to the infections, when we talk about case counts that are relevant to Toronto, yes, we are talking about Toronto residents. I think it's the conditions that's the important component here, though. This notion of socializing indoors in large groups where people get together and they let their guard down. And, we all understand, weddings are wonderful events. Where, frankly, we want to be together and to have that kind of closeness. But that's exactly what we shouldn't see if we're trying to reduce COVID-19, what we don't want to see if we're trying to reduce the transmission of COVID-19 in our community. So it's about keeping that distance and recognizing that, yes, you can get an infection, even when people are related to you, even if they're people that you know well. And even when you're in that circumstance where you let your guard down, that's the exact time where you need to stop and think, is this the right thing to do? That's the circumstance that we're seeing that is giving rise to transmission and infections. And that's why we're asking and appealing to our members of the public to really think carefully about what they're doing, to engage in these self-protection actions of watching your distance, wearing your mask, and washing your hands. And trying to find ways to connect and to, get all the functions of daily life, the various activities that we want to do, either in a low contact or no contact way.
As a follow-up, just trying to get a better sense of how case investigations work, though. If a large event were held in Toronto, there was a positive case at that event, but that individual wasn't necessarily a Toronto resident, would Toronto Public Health still get involved because the venue was in Toronto, and how would that be?
Yes, so briefly, if the situation that you've just described occurred where we have a large event in Toronto, but with a case who is a non-resident of Toronto, that case would be managed by the jurisdiction, the public health unit for the jurisdiction where the case resides. But yes, Toronto Public Health would be engaged in the follow-up and in the investigation, given that the venue is here. And most often with those kinds of venues, given the nature of how we live, work, and play in the Greater Toronto and Hamilton area, chances are we would have Toronto residents who might have been exposed, and those would be our responsibility to follow up on.
Okay, thank you. We'll go now to Jason Chapman from Global 640 News. Jason, go ahead, please.
Thanks, Brad. Dr. Davila, a question for you. There's been a lot of comments on Facebook about back to school, and they center around parents not being able to send their kids back because of a runny nose. I'm just looking for a bit of clarifications and then your thoughts on this as well. My understanding is if a child has a runny nose, he or she should not go to school. They need to go to a doctor's office and get a note. The doctors say they don't have time to write those notes. They need to go get a COVID test and then wait a day or two, or they need to just wait for 14 days. Is there any thought of going to a 2-symptom approach where a child would need to exhibit more than just a runny nose to stay home from school?
So I realize that, this is a very complicated endeavor, right? Trying to get our kids back to school. And we know that many young children present with these kinds of symptoms of runny nose. And as we're moving into cold and flu season, this is something that we need to be very mindful of. And each situation will need to be managed on its own unique circumstances. But I think generally there are a couple of things. One, sometimes if we're talking about something like allergy, if you get response to allergy medication, right, a good response, the runny nose, the symptoms disappear. They're the typical allergy symptoms, and the symptoms disappear with treatment for allergies, then you have a pretty good indication that what you're dealing with is allergies. And that's something that I think families can discuss in concert with their own primary care providers. But I realize that there are complications. There are no simple answers. But when it comes to determining what the protocols are, that's something that is being done, quite frankly, by our provincial counterparts, both at the Ministry of Health in concert with their colleagues at the Ministry of Education. But fundamentally, at the individual level, I think you have to look at the unique individual circumstances. I realize that not always easy to get access to primary care physicians or to primary care providers, but to the extent that there are services available, we certainly have some services at Toronto Public Health. Telehealth Ontario also is providing some assessment supports for families and students to try to make sure that we're keeping kids in school as much as possible. But let me just say this. What's really important in terms of ensuring that our schools are able to operate as safely as possible and with as much in-person education as possible is keeping the community rates of COVID-19 as low as possible. And that's on us to follow self-protection measures as much as possible. Again, watching your distance, wearing your mask, and washing your hands.
Yeah, so just a very quick clarification then. A child could be allowed into a school with a runny nose, provided what?
So I think that there are, if we have reason to believe, and this is going to all depend at the individual level, if there is reason to believe, for example, that what you have is a case of allergies, then that might be a circumstance. And I will say might be a circumstance in which that would be allowed. It is difficult to make sweeping generalizations here, at a microphone at a press briefing. Individual assessments need to be done for individual circumstances, and individual risk assessments need to be done in the context of that particular school to make the best decisions. So I would leave those decisions to those who are actually involved in the situation, who are fully familiar with the circumstances, and can actually make an informed decision.
Okay, thank you. We go next to Matt Bingley from Global TV News. Matt?
Hi there. Thank you very much. Mayor Tory, looking at the breakdown of the number of complaints over for infractions for COVID-19 bylaws, whether they be groups of indoor gatherings that are over 50 or over 100 outside, there have been hundreds of complaints that have yielded maybe about 4 dozen warnings, but there has been no charges laid yet. And I'm just wondering, when you say that you don't want to go back to that sledgehammer approach, what's at stake here? When will the city get more tough on this? And I know that you have emphasized the point of education over fines, but when there is so much at stake here, when will the city step up and get a little tougher?
As you know, and I always repeat this because I think it's important for people to understand, I don't, and nor does the city government, control what enforcement people do. They are using their discretion as they see fit. I do think, and this is my opinion, that we have passed over a point which I think from what I understand, is in their minds as well, that where we have, say, fewer people now devoted to going to beaches and places like that just because of the change in the weather and so forth, that you will see not only increased presence of people at some of the other places where these gatherings take place, but you'll also see, I think, that the days of warnings, since most of the people who are transgressing here are people that are repeated offenders. They're visited once, they're visited twice, and I think that after, some people might argue one, but certainly after 2 visits, I think we're now finding that the repeat offenders are going to be dealt with in a harsher manner. But again, to come back to something Dr. Davila said, which I now have become very convinced of as a result of just listening to the evidence, it is less about the venues. Certainly we have to crack down, I think, on people who are repeated violators of these rules and of these orders and laws, but it is also just as much about behavior and about the fact that people have to, the hosts, the visitors and the staff all have to remember the basic guidelines. Wash your hands, keep your distance, and wear a face covering. And if people did that in all of those cases, there would be much less to enforce.
Well, speaking on behavior, this message that you are relaying today has been said over and over and over for about half a year now. It's clearly not getting through to some people. Have you considered altering that message track or reaching out to an ad agency or anything in that sense to try and get to these people that are not learning from it?
When we met as a group of GTHA large city mayors earlier this week, the one thing that we did agree upon was that we need to, together and independently of each other, conduct more vigorous public education campaigns. And we even agreed to share some creative we would develop with each other to kind of reinforce that message. Because clearly, I think while it's the case, and let's remember this, it's a small minority that haven't got the message that aren't with the program. It is a big enough minority that it is causing some spread of the virus and causing numbers that are negative. When I hear that we have a transit system where we made masks mandatory and that 95% of people are complying with that, I'm very gratified by that, because I think that's a tremendous compliance level, especially given that some of the remaining 5% could have medical exemptions. But there is a core group of people who are both as hosts, as operators of businesses, and as guests are not performing well, and there are people who are doing that in their own private residences, hosting and attending parties they shouldn't be, given the size and nature of those parties. So I think we have to try to find new ways to get the message across, but the message is the same because it's the same. If I could turn to Dr. Davila and get some new answer, because it is Wednesday today, and that answer was going to be more effective at fighting this virus and fighting the spread of the virus and altering behavior, I'm sure she would have offered that advice to me by now without us asking. So it is the same message because it's the same knowledge that public health people have as to the best things that we can do.
Okay, thank you. We go next to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, this question is for either or both. At the beginning, you sort of quickly said that there's 3 things being looked at: reducing the maximum limits on gathering, enhanced enforcement, and expanding mandatory mask requirements. Those are all sound potentially significant. I'm hoping either of you can weigh in a little more detail, like how many people should be, how low a limit should we be for gathering? Should we outlaw weddings? On enhanced enforcement, Mayor Tory mentioned like harsher, but what does that mean? And where would be another situation where we'd be looking at having to wear a mask?
Well, can I just start by saying all of these things are under active discussion, both internally. That's why we had the meetings today, and we've had several meetings this week about these matters. But they're also, I think, in a way more importantly, under discussion with the province, and they're actively considering these things. And we're going to obviously try our very best to work in cooperation with them. I did make specific mention of the masking issue because it is one where we have been prepared as a city government to go further on the masking, because based on advice, we believe that's going to be something that's a very effective tool in the toolbox to help the spread of the virus. And with regard to consequences, I know the province again is considering ways in which to make sure that if you have one of these kinds of gatherings that's outside of the limits, if they happen to be revised, that it's going to hurt. As well it should, so that people get the message that, not only is this something that's in the best interest of yourself and your family and your neighbors to stay healthy, but it's also in violation of a legal order. And therefore, there's going to be a consequence to that. So those are all things that are under active discussion, but there have been no decisions made. And in a way, what we have to do at the city, whether we should have to or not, is await seeing what that order of government, the province, does, because, frankly, they have broader powers to do things than we do, and we'll then try to fill in as we think is necessary behind them.
So the only thing I would add further to that is that it's interesting, right? Many jurisdictions all around the world are grappling with the same issues as we are. And interestingly, when you look at how people in different countries, cities, et cetera, have looked at limits, the numbers are in fact all different, right? It's just a question of trying to reduce to a reasonable size for the context that you're in. We're in a large urban center. You know, how do we reduce the risk reasonably while trying to, again, maintain some semblance of balance between COVID-19 response and controlling COVID-19 transmission in our community, while at the same time, to the extent that it's possible, preserving our quality of life and preserving our ability to engage in activities that actually make life livable in our city. So we can try to provide as best as possible whatever evidence there is, but of course it's always context specific. And I think that that's why the conversations do need to occur. We have to think about what the circumstances are, what we're seeing in our data, where we might actually have potential to impact the trajectory of cases here in our city. And again, I cannot say it enough, right? Those self-protection measures are huge. They can actually, if each and every one of us does our part, we can significantly change this. We can change the curve, change the trajectory, continue to control COVID-19 in our community, and at the same time, have as much quality of life and live as safely as possible with COVID-19.
Thank you. And my follow-up is following on Kelly Grant's question from earlier. Dr. Davila, the details you've given in the last couple of briefings on sources of infections have been extremely general. We've seen in some other jurisdictions much more specific information given about the venue, but also about the circumstances themselves and the behavior that led to the infections. What is your main hesitation, given especially including we've had some infectious disease experts here in Toronto and elsewhere saying it's really important people know exactly where the infections are coming from. What is your hesitation? Is it confidentiality, or why aren't you being more specific like some other people in your position are?
So that's a very good question, and it's actually more complicated than it looks on the surface. So I think that when we look at our circumstances here in Toronto, some other jurisdictions may not be investigating as many and may be investigating in a slightly different set of circumstances. There may also be very specific public risk that's associated with those particular investigations. Without knowing the details, it's very difficult to comment on others' investigations. There isn't a hesitation really to share. It's a question of what we are able to provide. And to my mind, what we're seeing is it's not about specific settings. It's actually about behaviors. It's about the kinds of behaviors that people are engaging in that give rise to risk. I've spoken of people letting their guard down, and it happens in private homes. It's happened in venues that are more public, like bars and restaurants. It's happened in workplaces. It's happened in all kinds of venues all over the city. So there isn't a setting per se that appears to be higher risk than others. There are some kinds of gatherings, socializing indoors, whether it's at large family events or those kinds of social gatherings that seem to be giving rise to the risk. Hence, the nature of the communication we're providing is around, well, what can each and every one of us do? And it's around taking those self-protective measures, asking ourselves the questions around, how much risk am I exposing myself to? Is this an event I need to go to? Is this an activity I need to participate in? And must I participate in it in that in-person way, or is there another method by which to do this? So again, it's around what are the behaviors that are giving rise to transmission? That's fundamentally what's at the root of this, and what can we do to change that? And it's about self-protection measures that is within each and every one of us to do.
Okay, thank you. We'll go next to Mike Crawley from CBC News. Mike, go ahead, please.
Hi, Mayor Tory. Just a little bit more on your desire to see enhanced enforcement. Would there be more resources put towards specific cases of people, breaking the gathering limits? And would this extend to, we're talking, if what Dr. Davila is saying is that these things are happening in sort of smaller sized gatherings in people's homes, are we talking bylaw officers going into private property or anything like that? Can you tell me a bit more about what actual enhanced enforcement would be seen?
Well, the notion of bylaw officers, for example, visiting private residences is not unknown by any means. And so, for example, one of the things where they visit, I think, thousands of times a year is on noise complaints. And the correlation between a noise complaint coming in and a party that is probably in violation of these rules as they may be amended tomorrow, I would think is quite high. And so I think the combination of the fact we can reallocate enforcement resources from the beaches and so on as we change weather patterns and things move indoors, and the fact that you're going to find there is some correlation between things that bylaw officers and others like that would already be attending, I think will give us a chance to have a look at some of these parties. And of course, a lot of that is based on complaints that come from the public through 311 and otherwise. And so I think it will allow the resources we do have to be allocated to places where we know something is likely to be happening and to enforce more effectively. And I think if there are some enhanced penalties, which I suspect could be the case for the violation of these kinds of orders, then that I think will get the attention ahead of time of people, either those attending or those hosting, and maybe cut down on the number of these kinds of events that are happening, and maybe just common sense too.
My follow-ups for Dr. Davila. In relation to your knowledge of the source of transmission in a lot of cases, there's still a pretty high percentage of the cases that are just defined as community transmission or even unknown source of transmission. So how difficult does that make it for you to have an effective public health response if you don't know what the source of a lot of this spreading of new infections actually is?
Well, what we do know is that there are the majority of infections, I should say, are associated with close contact with a known case. So let's start off with what we do know and what can be done there. So there are a number of measures that we've taken in order to reduce that risk. Things like making sure that people move into isolation, providing an isolation center for those who actually have challenges. So there are actions that public health can take. But if you've heard many of us say, myself, certainly the mayor has repeated it as well, it's not so much about the settings, right? It's actually about the behaviors. So even within those cases, that proportion of cases, which I talked about, was about 20% that are ascribed to the community, and therefore without an exact known source of the case. We know that COVID-19 transmits from one infected person to others with whom they have close contact. So again, it still comes down to the types of behaviors and the situations in which we put ourselves. And we actually do have control, each and every one of us, varying degrees of control around what we can do. Some activities are fundamentally necessary, going to work. For those of us who are able to work remotely, then one way to reduce risk is to work remotely. For those who don't have that luxury, maintaining distance as much as possible from others, wearing a mask, washing hands, and of course, staying home when you're sick. These are the kinds of things that can be done. So to my mind, it is a partnership, if you will, and a collaborative effort. Public health can certainly do its role in respect of case management and contact management and investigation, and other sorts of services, whether it's around isolation or setting up isolation centers. But just as valuable and just as important are the actions that each and every one of us take in terms of protecting ourselves and protecting those around us.
Okay, final question this afternoon is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you so much for taking my question. Mayor Tory, regarding the enforcement of social gatherings, Premier Ford said today that fines will be attached to these and they will be the toughest fines in the country. He said this was going to be a provincial jurisdiction, not a federal jurisdiction, but it did remain unclear if the enforcement would fall on the shoulders of municipalities. And just by hearing you speak today, it does sound that way. But do you know if the OPP will be involved at all in enforcing these social gatherings?
Generally speaking, within the City of Toronto, the responsibility for this kind of thing rests with the local police, the Toronto Police Service, and with our bylaw inspection officers. And so I would expect that the bulk of the responsibility will rest with them. I am heartened by the fact, and I discussed this with the Premier today, that they're looking at significant fines, because I think we have to get the message across now. People referred earlier to the fact that the message doesn't seem to have reached some people, and sometimes the way you have to have a message reach people is by a severe consequence for their actions. And so in this case, I'm heartened by the fact that they're considering much stiffer fines. In fact, if they're the top fines in the country, then I think that's exactly where they should be, because we have a problem here, and we need people's cooperation to fix it, and those who don't want to get with the program should pay a price for that. So I think it will be mostly our responsibility, and that's something obviously that we're going to have to look at in terms of how we go about making sure that we, do it effectively, do it fairly, but at the same time, do it, because I think people are at the stage, by and large, where they would say, we want this over with. We want people to get on the program, and we want those who refuse to do so to be, to be sanctioned accordingly.
Thank you. And my follow-up question is a bit of a change of topic, but we wanted to follow up with you, Mayor Tory, about this staff report and the public consultations that are taking place regarding the renaming of Dundas Street. There are 4 options on the table, and we wondered which of the 4 you favor, if any.
Well, it would make a mockery of a public consultation, which is the first step we're going to undertake. Public consultation taking place within the historical context. I hope we can put in front of people, the whole story of things like Dundas Street and other things like that, and then have them give us their input rather than having some kind of top-down thing, whether it's me as mayor or the council or the city manager. So we're going to consult first, and we will then see what the public have to say, review the historical context, and a decision will be made. And there are practical consequences to all this as well. So let's let the process unfold in the way the city manager contemplates. I think he's done it thoughtfully, and I'll look forward to those consultations.
Okay, thank you very much for joining us, everybody. That concludes today's briefing. Have a great afternoon.